always had a goal at MediConnect, or a vision for MediConnect, to get the medical records back in the hands of the consumer. To be able to give patients access to their medical information and help them understand where to go to get it, how to get the information, and then once they have it, how to understand it, has been something that we're very passionate about. In the world today, it's really hard for consumers to drive their own healthcare decisions because most of them don't have any idea what's in their healthcare records written by their doctors. They don't know how to get their data. They don't know how to interpret the data once they do get it. And so for us to be able to put consumers' health information in their hands and not just get them the actual record, the physical record, but to get them a kind of a subset of the data of what was important from that record, the things like what procedures have been performed, what were the different diagnoses, what were the immunization tracking they had for their children, to be able to pull that information out of the record and put it into an easy to understand format, it gives them control of their information to be able to make better choices for their families. There was a woman the other day who expressed a story of her mother who had been in the hospital for a procedure and was about 90 years old, had a colonoscopy done, and then was moved to a short-term care facility waiting to get into her long-term care facility. Because they didn't have access to her mother's medical records fast enough at the next facility, they repeated the colonoscopy at 3 different facilities on a woman who's over 90 years old. They put the patient through a tremendous amount of pain, and the providers themselves giving their time for something that had already been done. And those are the types of things that happen when we don't have good access to our medical information. That's why it's critical we find a way to get consumers their records available to them, not just for their sake, but for their families as well. The way that the consumers can order their healthcare records is to come to the MediConnect website. There's a link on the front page to Google Health that'll take you into the Google Health portal. Once you sign in, you go to the Select Online Services portion, and in there you'll see the menu option to link to MediConnect Global's account. You'll be able to request your records directly from MediConnect, and we will go and retrieve your patient records, have those come into us, we'll digitize them, and then our nurses and coders will actually go through and mine out the important data elements so that we can send those through the integration to the Google Health portal. When the records are ready, you'll get a notification back into your Google Health portal, or we can send an automated email to your email account letting you know that the records are now ready for download. You go back into our secured site and you can download an actual copy of the PDF form that you can keep that record on your home computer. You can put it onto a USB keychain to keep with you at all times. Privacy and security are of the utmost importance, obviously, for what we do at MediConnect. We're gathering medical data and information from all over the world on patients, and it's their most private information. So everything that we do is centered around security and privacy. We absolutely honor all of the HIPAA confidentiality requirements. I think that the value for this for the patient is just tremendous. To be able to have a way to get their medical records, many of them don't know how, they don't know where to begin or where to start. And so to have access to a company like MediConnect where they can come in and order their records and we take care of all of the hard part for them. And I think having that information for patients is incredibly valuable. And to have it in a way where it's not just accessible as the true document PDF, but then to have that elements of data pulled out that matter most and summarize it for them in a way that they can understand, I think it's a huge step in the right direction for changing the way that healthcare is handled today.